Thank you so much for joining us this evening. We always love to see those familiar faces. And those who are new to us, welcome. We do these every single month. They're always specialized in sleep and TMJ or practice growth in these areas. So if there's ever anything you'd like us to cover, feel free to drop them in the chat box, and we can most definitely address those topics at a future webinar. The best way to view the webinar today is the speaker view. So in the upper right-hand corner, if you'd like, you can click the view button and select speaker view, and that'll give you a really nice side-by-side of Frank and the PowerPoint today so that you can kind of see everything that's going on. As you've noticed, your camera is off and you're muted for the webinar. So if you have any questions at all, Frank's happy to address those. Make sure you either raise your hand and I can unmute you, or even better, utilize that question and answer or the chat box. And I can stop Frank and we can get those questions answered. So we love questions. Feel free to put those in there throughout the webinar if you have anything you want addressed. As you know, the topic today is troubleshooting device delivery with our president and founder here, Frank Madrigal. So if you have any questions, like I said, throw those in the box. We'll address those throughout the webinar, and we'll also be providing a promo code at the end. So make sure you stick around. And I'll pass it over to Frank now, and he'll get started.
Thank you, Trish. Hello, everyone. Thank you for joining us. Number one, I just want to let you know that we are grateful for you joining us tonight. I know it's late for those of you on the East Coast. So, and for those that are not on the East Coast, we still appreciate you and we value you taking the time to spend with us. So, and we hope to bring value with the information we share. And again, as Trish mentioned, I want this to be an interactive presentation. So please, if you have any questions or comments, or maybe you can share an experience or even a solution, we'd be happy to have that interaction with you. Other people attending the webinar could definitely benefit from these types of discussions. So welcome. All right, so just a little bit about me. I've been doing this for a little while now. Someone reminded me the other day. So I started as an RDA, as an assistant. I worked at a dental office where the clinician treated TMD and, in time started to do sleep devices as well. I got to work in all aspects of dentistry, just about all aspects, including oral surgery and orthodontics and restorative, of course. So I got the opportunity from the clinical perspective to see, and to participate in some of the deliveries and of devices and dentures and partials and crowns and all that. A lot of things that are still done today. And so that clinical experience really gave me, I feel that it gave me an advantage as a technician to have a better understanding that we're not simply working with, a set of models or a set of scans, but really to have a better, value for the experience that clinicians get to have every single day with patients. From the laboratory side, again, I was blessed because I've done just about everything as well, including orthodontics and orthopedics and dentures and implants. And, now with digital 3D printing and milling, we do a tremendous amount of milling here. And a lot of my time is spent developing processes now at our company, developing products. We got some exciting products coming soon, so can't wait to share with you as soon as we're able to. Okay, about true function. Again, we started in 1999, and that's not a picture of me, by the way, back in 1999. That's Prince. And so all we do are oral devices. We do nothing else. TMJ splints, occlusal guards, sleep apnea, oral devices for treating sleep apnea. And of course, the majority of the work we do now is digital. And this picture is a little bit, a couple years old now. Our team has grown. We have a wonderful team, great people here, people that are young in their late teens, I believe, to, amazing people like Mario, who's been with our company for over 20 years now. So we are blessed to have such a great group of people working with us. And of course, clinicians that support us. All right, so why would you work with us? Well, I believe we're amongst the experts in our field. Again, based on my clinical experience, we really do, I do my best to share with my team that every single case, every single patient, you know, is your reputation as a clinician. So we value that. We appreciate that. And we do respect your time. We have one of the fastest turnaround times in the market. We do everything we can to get cases on time or early. And our major goal is to reduce your chair time. All right, so these three words, exciting and unpredictable and adventurous, I'll tell you, I've lived them, at work. But if I have to share something with you, I don't think these are three words that you want to have in your day-to-day practice. So my goal is to share some knowledge and discuss with you, ways that hopefully we can make it a little bit more boring. All right, so let's go with some troubleshooting. We're going to be talking today about fit issues, bite issues, of course, like what types of things might cause bite issues, and then patient comfort. So some of the things that affect patient comfort in how we go about making these devices and including some of our records. Okay, so all right, let's talk about fit issues. What if a device isn't seating at all when you get it? What do we do about it? What might be the cause? What if it's too loose? It's just too big for some reason. Um, or too tight. Too tight. By the way, I don't think that's me in the picture, but it could have been me. I don't remember. All right, so let's talk about a device not seating. Uh, number one is this the right case? Is this the right patient's case? It happens everywhere. It's happened to us in the past as well. We get scans, we make a device, we deliver it, and the device is not the patient's. So what happened? Could it be a scan quality issue? And could it be an issue of, fabrication? Did the lab or the manufacturer do something wrong? So when it comes to making sure it's the right patient or it's the right case, Um, this is why we recommend that when you request cases back, that you request them back at least 1 day before you deliver the device. This gives you the opportunity to verify that you got what you asked for, the proper device, that it fits the models properly. So I would recommend taking the device out, fitting on the models, get a feel for how it fits, and just overall quality check. Make sure you got what you asked for. All right, so we're going to look a little bit at scan quality here. And, obviously there are multiple reasons why we can have scan quality issues. Um, anything from scanner calibration. I understand they're very temperature sensitive, for example. Of course, excessive saliva, difficult patients. Some of you get to see special needs patients or very ill patients. So, those can be challenging. And again, metal restorations. I mean, those are some of the tough ones to get scans on. So let me see if this guy opens properly. Let's see here. Oh, it opened. It worked. Okay, good. So let's pop these scans open real quickly, and then we'll take a look at what we've got going here. All right, so we've got our bite scan and maxillary arch and mandibular arch. So to start, we have a lot of texture on this arch, on these arches. And so this obviously can create an issue because when the device is designed, um, it's got to go around all those ridges. So it could be either not fit properly. Obviously, it won't fit properly. So it may not seat well. Or there might be some resistance when seating. It might not seat at all. Another thing is the large holes, right? Although they're on the mesial in this case and distal, it's still necessary to capture as much of that anatomy as possible. And then this tooth, this molar on the left side, again, very, very large holes. Uh, you know, yeah, just a lot of distortion on this scan. And look, like I said, there might be multiple reasons why you could, maybe it was last patient on a Friday and you had a long weekend ahead. Kidding. But maybe again, very, very difficult case, difficult patient, many, many reasons. So, what can we do about this? Let me close this back down. All right, let's see here. Go to my next slide. All right, so what possible things what can we do? So the great thing about digital, again, is you get to see it right away. You get to see the scans, you get to see the quality, you get to see your bite relationship. You see everything on a giant screen. So this is an opportunity if you have the time and if the situation is right, again, if your patient is able to allow you to take new scans, you rescan. That's the best thing to do. Other options would be, to do a traditional impression. Uh, and in worst case scenario, you let us know, hey guys, this is best we can do. Difficult patient, difficult situation. Do a thermocryl liner on this case, and this will allow the device to fit, allow us to fit it at delivery. But you having the awareness as a clinician of what the situation is with the scans gives us the opportunity to give you the best product possible. All right. Okay, obviously, it's not always on the clinician side. Many times it can be on the lab side, on the manufacturer side. So there are multiple reasons why a device wouldn't fit properly from our side, from the manufacturer side. One of them is, hey, what if we're making a traditional acrylic appliance and there's a distortion in the 3D models that were printed? Well, the device will probably fit the models, but not fit the mouth, right? That's an issue. Um, Maybe the lab tech didn't do sufficient block out, um, and the device is so tight that it just won't seat, or maybe it's incorrect parameters. Now, if you're familiar with digital dentistry, there are different parameters that are used for different types of materials and different technologies. So a 3D printed night guard and a milled night guard are not going to have the same parameters. They're going to be different. So all those things, ensuring that the processes are correct at the fabrication, um, can make the difference. So how do we verify at True Function? How do we check these things? How do we know, hey, is it one thing or is it another? One thing that we do when cases are returned is we will compare the models. We can compare scan to scan. If you take, send us, we have the original scan and you take a new scan, or if you send us the models, original model and a new model, we can compare one to the other. And our goal is to have, not more than 100 microns, for example, in difference between, the original and the new. This is how we're comparing to see if the records are consistent. Um, so in this case, hey, these models look pretty good. I think we're in good shape. So it probably wasn't a scanning issue. There was more to this case. Now, this is a trouble case. So in this instance, the differences are vast. They're large. There are, I think, what, 250 microns, 300 microns. Now we're having large distortion issues. There's something not right with this case. So um, this is how we're able to again, relate models and scans to each other to help us to figure out what the cause was of the fit issue. All right, so let's talk about too loose. Especially we see this a lot with elastics. So that's something to consider, especially on lower arches. Things to consider when you're making devices, that is that when you engage elastic hooks or when you engage the devices where they're held together in some way, there's going to be some tension. So knowing upfront what the patient's anatomy is maybe can help you decide on, hey, you know what, we might want to use this material or this device design, or maybe go traditional, as opposed to making a milled or a 3D printed appliance. So just, things you want to look at patient's anatomy and understand what you're trying to achieve so that you can make the best decision possible clinically for your patient. And just know that you have resources in us, for example, to help guide you if needed. Many times when we find a lack of retention, we're going to reach out to you. Obviously, issues like, popping off an opening or the device dislodging while sleeping could be another issue. I mean, and one question to ask, if retention is really good while they're awake, why is it ending up on the side of their pillow, when they're sleeping? There might be more to it. There might be more to it. All right, so again, possible causes, right? So from the manufacturing perspective, you'll probably find out very quickly if there's a lack of retention or it's loose, because at delivery, there's a decent chance you're going to find out that it's something didn't go right with your case. Of course, again, I talked a little bit about patient anatomy. That could be a cause, right? The really straight up and down teeth, the short clinical crowns, all the stuff that we're aware of, missing teeth, all of those things, lingualized teeth, especially posterior teeth, all of those things cause lack of retention or retention issues. We'll talk a little bit about the device choices and then excessive advancement as well. How can that cause, for the device to become to lose retention? And then, I always talk about expectations as well, setting the proper expectations for the patient, and then as a clinician, having the right expectations for the device being used for your specific patient, and so that we're not expecting. I guess I think about dentistry as a whole, and as clinicians, dentists are perfectionists, and I see this all the time. You want to create the perfect margin and the perfect case and perfect morphology and beauty, and I really love and I appreciate that. Uh, the only challenge here is with oral devices, we have so many other variables that we're dealing with, that where sometimes it's not going to be about perfection, but it'll be about excellence, about doing the best job possible for your patient and helping them have a better life. All right. So again, from the manufacturing perspective, maybe the lab did something wrong. Maybe we overdid the blockout or we used the wrong parameters. I talked about that. Maybe we didn't extend the coverage sufficiently. And most times you will find out immediately, right? You go to deliver the device, you fit it, it wiggles in the mouth, or it just comes off too easy. So that's typically a manufacturing issue. Now, again, I mentioned that when you go to deliver the device or when you receive the device, that you should do like a quality check. Just check it on the models that you received. It should fit in the patient's mouth in a very similar way. So the retention should be similar. The way, the path of insertion should be similar. That helps you as well to have an idea of how it's going to seat in the mouth. Now, if it's consistent, on the model in the mouth, that's one thing. But if it's inconsistent, right? If it's tight on the model and it's loose in the mouth, number one, take a new scan. Take a new scan, and then we can investigate to see what the issue is. But it absolutely could be a manufacturing issue. All right, so what about too loose or lack of retention? Right? We talked about lack of patient anatomy. So again, anytime we engage elastics to keep the mouth closed, we're going to compromise retention. We see this tremendously. We see this a lot. So these arches here, if you look at them from the occlusal view and you can see the gingival margin, that's a sign that we're not going to have enough retention. We may luck out on the maxillary arch here, but on the left side, but on the mandibular arch, there's no way. Maybe if we're lucky, if we add ball clasp, for example, but once you engage elastics, there's just nothing to hold on to. One thing we could possibly try is extend the coverage, extend the buccal lingual walls onto the tissue. I know some of you don't really like that, but those are things we may be able to do to help with managing the issue, but may not resolve retention challenges. And this is where, again, you got to set the expectation for yourself and for your patient. Like, hey, your teeth have not a lot to hold on to. The device may tend to pop off. If it happens, put it back in, go back to sleep. But just being realistic because and understanding that sometimes it is a little bit of a compromise, but it's absolutely better than not wearing anything at all. All right, so again, we see a few of these cases where we're either building overdentures and once in a while we'll get edentulous cases. Well, retention will be compromised. Retention will be compromised. So obviously, there are things we can do. Some clinicians will carve retention grooves onto the dentures themselves or add a little bit of composite to the buccal surfaces of the teeth. But if they're overdentures, we might have more luck. If they're just dentures, something's going to give. Something will dislodge. So just things to consider, and have the awareness, and if you have the ability to and the flexibility in your practice to add retention, and your patient's up for it, that might be a way to go. Might be a way to address this. All right, so I wanted to talk a little bit about retention. Look, this is an EMA. When we started with the treatment position, 21 millimeters, that's the longest strap for the EMA, as far as I know. Edge to edge, got good retention, we are good. And then you advance the mandible a few millimeters, and now we've got a 15 millimeter strap. Well, now the strap is vertical. Instead of pulling, diagonally, mostly horizontal, now it's pulling vertically. And there's a decent chance the lower tray will tend to dislodge. So for multiple types of devices, once you advance the mandible, there's going to be a chance of something not going well. In this case, the lower tray will tend to dislodge. So then you'd have to make decisions like, okay, is this the best we can do? Are we able to reset those buttons? Maybe we get a little creative on how we move those buttons around so that they become a little bit more horizontal again. But this is one of those things. You advance the mandible, and now we have pop-off issues. Maybe you prep your patient and say, hey, this is good now. It's going to tend to want to come off. Just be aware of it. Thinking out loud. All right, too tight. Again, this may or may not be me, just saying. So we'll talk a little about that and patient discomfort related to devices being a little tight. Okay, so let's talk about patient anatomy. So one of the biggest areas of discomfort that I've heard from our clinicians are when teeth are rotated or they're misaligned. I think about that lower arch and I see those teeth just overlapped and they're all over the place. This is an area where a lot of you end up having to grind out those interproximal areas around those teeth, and I'm sure you're familiar with that. So, this is a patient anatomy issue, and it's a balancing act because if we over relieve the device, it may become a little loose. If we leave a little too much retention, it may cause discomfort. So we're always trying to balance comfort and retention with these types of cases. The other is the image on the bottom, that upper arch. If you look at those second molars, how flared out they are. So they're buccally tipped, and the device, especially if it's a larger device or if it's rigid material like PMMA or acrylic, the lab or the manufacturer has to do an excellent job of blocking out because otherwise that device will tend to be very, very tight and difficult to seat and remove. So those are areas to keep an eye out for. Um, the other thing is if a device is tight, what some of our clinicians have done, have discussed with us and really taught us is, they'll work on the embrasure areas first. So interproximal, areas on the intaglio, on the internal part of the device, all those points that stick out, they relieve those. And then of course the undercuts of those, really buccalized teeth. So those are areas where you should consider adjusting before sending back because it might be a relatively simple adjustment. The lab manufacturer has done most of the work. So if you're comfortable with it and you want it to relieve, start with the embrasures and then undercut if needed. All right. So again, from the fabrication side, I mentioned it. Maybe we overextended the coverage, and the more surface area you have on really big teeth, the tighter it's going to feel for the patient. So there's just that's a possibility. And of course, if it wasn't blocked out properly, we maybe didn't use sufficient blockout in specific areas. All right, so bite issues. We might have excessive anterior opening. I'm sure all of you have seen those types of cases when you go to deliver an appliance or a device, whether it's a night guard or TMJ splint or sleep device. We've all seen them. We've all seen them. Unbalanced occlusion, where maybe you have that one contact on the right second molar region. Posterior interference, maybe they're hitting just in the back on both sides. That's all. That's the only place they're hitting. The question is why? Why did it happen? Uh, well, there might be several reasons, right? Number one, the first question to ask is, did the device fully seat? For example, if you try in a sleep device, you try in this Herps device, and it's attached, and so you place a whole thing in the mouth, both trays in the mouth, and then you seat it, and then it looks like this. The one thing I would recommend, um, by the way, we don't no longer make them in blue, we make them clear now. And so what you could do is you could look in the back, use a mouth mirror, look in the back, and make sure that the device is actually completely seated. Now, if you can't quite tell, then I would recommend disassemble, remove the arms, and place one tray at a time. See one tray at a time, make sure that you know that it's fully seated. And if it's giving you a lot of resistance, then you may not want to force it in the mouth. You might want to do some relieving first if that's what you're sensing, that it's not seating all the way. Because that may be the cause. We might like start chasing our tails, working, taking new scans and sending a new bite and doing all this stuff. And maybe it's this simple solution is maybe it was too tight and it needs to be relieved some. And typically it might be in the molar region. Hopefully that, if it's that simple, it's relatively easy adjustment. And then you get it back together and you deliver it to your patient. Now, again, if it is seeding all the way, there might be other things. There might be other issues with the case. Um, Alrighty. Okay, so again, excessive opening, same thing, right? Is it fully seated? Does the patient have an anterior open bite? Is there an issue with the manufacturing? Maybe the lab mounted the case wrong. It is very possible. It is absolutely possible. Maybe if it was made digitally, somehow, the models were moved incorrectly. That's very possible as well. All right, so unbalanced bite, or if it's high or anything like that. One thing I think about is this. I think it's a George gauge. This bite fork, where we simply didn't get enough material over the occlusal surfaces. So when the case is mounted, it's not stable, it's not sufficiently stable, and it might rock one way or another. So if it's mounted incorrectly, maybe it's mounted like this, where it's higher in the back, and that's what throws it off when you go to deliver the device. So typically, if we see something like this, we do reach out and ask for a new bite. Um, but those are things to think about. If you're using traditional bite forks, just make sure that you have sufficient bite registration material from cuspid to at least the distal of the first molars on both sides. Now, actually, I'll take it back, because some of our clinicians, what they're doing now, they're also simply doing a bite jig in the front and then adding bite registration to the second molar region, for example. And that works. You got a tripod, you got a nice stable bite registration. That also works. And the reason a lot of them do it is because they're also scanning that relationship. So it leaves some open space for you to be able to scan. All right, so unbalanced bite. Uh, this is a digital bite. So I don't know if you were able to see in the image, but the tan is the model, the blue is the bite. There is a discrepancy, especially on the patient's left side, second molar reading. It's clear there that they're just not aligning. They're not matching up. Let's see if I can. Oh, let me go back and let's see if it'll let me, if it'll allow me to. I think I can. I'm going to bring up another set of scans that are similar. And let's see here. All right, let's go to. All right, let's bring these up. Okay. All right, so we have a misaligned digital bite. So we have our maxillary model, our bite, and our mandibular model. So we get the scans that look like this. We're more open on this side, and we're fully closed on this side, at least in the molar region. Now, when we bring the scan bite back, it's misaligned. So fortunately, in many cases, we actually get the scan bite and we are able to identify that. And we're able to correct it. But if we simply get a maxillary and a mandibular scan, which in many cases we do, we don't get to see that. So in a case like this, let's just say if we didn't get that bite, we probably would reach out and say, "Hey, doc, there's something not quite right on the left side. Is this correct?" I mean, we do a lot of TMJ cases. This could be correct for your for your patient. But those are things to look out for when you're doing your scanning, and to ensure that the bite scan aligns correctly. Because let's say we all miss it. We all miss it. We make a device. where, where's the device going to be high? So yeah, things to think about when we are working with scans and with buy registrations. All right, let's get that out of the way. Get this out of the way. Alrighty. Great. Okay, so let's discuss patient comfort issues. We'll talk about a few things like, device designs, jaw position and patient anatomy. All of these things can affect patient comfort. And I wanted to talk a little bit about the design specifically. So we're looking at, in this case, the True Herps. So it's a bilateral compression device. And again, it does come with the telescopic arms, and it has we call them pivots, the little anchors that hold the arms in place. Now, what I want to point to is the position of these pivots or anchors. On the upper, the anchors are in the molar region, and then on the lower arch, they really end up wherever they end up because it's based more so on the length of the arm. In this case, this arm is 27 millimeters long, I believe. So depending on patient anatomy, how small their jaw is, how protruded or not their jaw is, that's where it's going to end up. But ideally, those pivots would end up like right around the first premolar. And the reason is we want it to be away from the commissures of the mouth. So we don't want those pivots to stick out too far because then they would cause discomfort for the patient. All right, so here's a case. We got a case. The clinician communicated to us, hey, this is causing discomfort for our patient. What can we do? Or so again, we would want to look at this specific clinician is kind enough to share his where he wants the premolar or the anterior pivots or anchors to be located. So typically you say, hey, do not bring them more forward than first premolars, or don't bring them more forward than these teeth here. So that guides us in terms of what we can do and where we can place the components. That's very valuable. Um, Another thing is maybe, you know, this may not be the best device for this patient. If the patient has tight lips or they're prone to having issues. There are many patients that get these herp style devices and they work just fine for them, but certain patients is not going to work for. Um, and Again, bite precision could have something to do with it. So I want to talk a little bit about the bite and how it could affect, the outcome for the patient. So here's a little bit of an extreme example. What I've found actually recently, is that when the mandible looks retrusive for a herp style device, there's a decent chance that the arms are going to be too far forward based on where the components are placed. So then we'd have to talk to the clinician and decide, hey, do we want to push those arms back? Do we want to use short arms? We have short arms available that are 5 millimeters shorter, which makes a huge difference, of course, as you can see from the images here. But those are things to consider. And if your manufacturer, your lab isn't thinking about this, then that's where you have those devices that are extremely bulky in this area. And look, it's happened to us. It's happened to us. And those are the types of things that we get to learn. So retrusive bite, herp style device, something to think about. You want to consider what you're going to do for this patient and whether that is the right device for them. All right, so a little bit on the lip seal or over opening, right? I mean, look at this flat plane splint. We've got about 6 or 7 millimeters of opening in the anterior. That's just crazy. Will the patient wear it? Will it be comfortable for them? I don't know. I don't know, but if we see that, um, we should say something. See something, say something, they say. So from our perspective, we do our best to catch this type of stuff up front so that we don't give you a very bulky appliance. Along the years, we've learned. I mean, heck, we get a lot of these. We've gotten these types of calls. Hey, this appliance is extremely bulky. What's going on over there? And the fact is that, we have to look at what's happening with the patient. This the image on the bottom is a whole different patient, but similar situation. They have an anterior open bite. So anytime we have to create a millimeter of space between the cusp tips and the posterior, for this patient, we're looking at again, an opening of 5, 6, 7 millimeters in the front. And that's just with a flat plane. So if we wanted to add some anterior guidance, it's going to get thicker. If we're going to make a sleep device, it's going to get thicker. So these are things to consider when we're making devices or appliances. What's your patient's dentition like? What's their occlusal pattern like? What's their curve of speed like? There's a lot of things to think about. Curve of Wilson, super erupted teeth, you name it. There's a lot. There's a lot. All right, well, let's look at this one. Speaking of excessive opening, so you know what? In the lab, we might think, hey man, excuse me, hey doctor, this case is extremely open. Is this correct? You might say, yeah, I meant to do that. My patient needs to breathe. Awesome, thank you. Thank you for letting us know. We'll make a note. Do you want us to make this your preference? Maybe that's your preference, and that's okay. Maybe your philosophy, you believe very, very strongly in wrapping, all the teeth, and you're okay with raising the vertical as much as needed. Cool. We can make that your preference. It's just a matter of understanding, so not that there's anything wrong, but it just having that communication and understanding that this was meant to happen. Because the last thing we want to do is make a device that's extremely opened, and maybe there was a bite misalignment issue, right? Maybe it was a big discrepancy in how the bite aligned, and that's not what you meant at all. So, of course, that could cause, patient discomfort. So just a lot of things that we look at when we're receiving your cases, when we're, planning to design the devices and make the appliances. We're looking at a bunch of little things. Okay, so I wanted to talk a little bit about the bilateral interlocking or the dorsal style devices, because a few times we've run into a situation which is very interesting. And again, we're constantly learning, and we want to share this knowledge. Some of you probably already have it, and that's a great thing. But what we found is, so we have the advancement mechanism, the little screw, the blue screw on the upper arch there, on the upper tray. And typically, again, similar to the Herbst style device, it's placed on the upper molar region. And then, and it rests against that fin of the lower arch, and that's how it supports the mandible in position. And then as you advance the mandible, part of the screw, the front half of the screw comes forward, advances the mandible. So that's basically the titration mechanism of the bilateral interlocking or dorsal style device. And this is a great device universally. It's an amazing device. People love using these, and they're wonderful. Here's something that we've run into a few times. And so I wanted to bring up these images. So here's a skull. I'm not allowed to touch patients, so this is as close as I can get to a patient. And this one doesn't bite back, so it's a big plus. So I'm looking at the patient closed completely on the left side, and if you look at the medial border of the ramus, you can see the wisdom tooth, so you can see the exposure. So if you remember where we placed the components on the dorsal style device or even the Herbst style device, it's in the first and second molar region. So when we do a protrusive bite, especially if the patient goes beyond edge to edge, or maybe you advance the mandible beyond edge to edge after a while. If you look at where the ramus now ends up, you'll see that this can cause patient discomfort issues. So we've had a few cases where the clinicians has reached out and said, hey, patient puts a device in their mouth and it hurts. It just hurts for them to close into it. And so by resetting the components, moving everything a little bit forward, a few millimeters forward, it makes a difference. But having that awareness, right? From the clinical standpoint, you may or may not be working with us, but you want to have the combination communication with your manufacturer or your lab and say, hey, please bring the components 3 to 4 millimeters forward of where you normally place them for this case, or something like that. So again, having the awareness of what may happen so that you can plan and predict, how to better treat your patient. Alrighty, so again, patient comfort. And this patient obviously has several issues. We got an anterior open bite. We also, if you look at those wings on the Panthera device here, this patient has a tiny mouth. And I think it was probably a similar issue as it was with the dorsal, where this patient's mouth is small. They came forward, and look at how far these wings stick out. That causes discomfort. It causes discomfort. Maybe we change the device type. Maybe we make an EMA, or we make something that, maybe a Herbst, I don't know, maybe you make a tap, for them, a device that won't, uh, will fit better for this specific patient, won't cause that type of discomfort. Alrighty, so here's what I want to say. I want to make it boring for you. I want, making oral devices and making TMJ splints to be as pain-free as possible for you. And this is how we can achieve it. Whether you work with us or you work with a different lab or manufacturer, meet with someone. Make sure you get together. You establish your expectations of what you want from your devices. Understand their products. Tell them, hey, for clinical matters, you reach out to this email, and this is a phone number. And for billing matters, you talk to my office manager, and you just set all the expectations and make it very clear. And of course, whomever you're working with must be someone you can actually communicate with. I mean, you can't always talk to robots, so that's a big plus of working with us. Great. And again, if there's ever an issue, what we strongly recommend and we ask for is to take new records. Take new records, make specific notes about the issue. Don't just say, hey, it's not fitting. Say, hey, it's too tight on the upper right side, or it's not seating at all, or the lower trays, whatever, right? Or it's irritating the patient's, corners of the lip, whatever it is, make specific notes. If possible, take images. A lot of our clinicians do when this stuff happens. And then we coordinate, what to do, whether we remake it immediately if we think we know what the issue is, or we request the device to be returned along with records so we can investigate more deeply. Because again, the last thing we want to do is repeat the same issue. If you simply say, remake it, I had to give it to my patient, just make me a new one. What if we give you the same stuff? Because we don't know. And then your patient's unhappy a second time. So this is why we ask for records. So no matter, again, who you work with, whether it's us or someone else, they will appreciate that, and it'll be easier for you to be successful in the future. And I think that's about it for me, everyone. Thank you so much for your time. If there are any questions, please let me know. And here's my contact info, frank@truefunction.com, real easy. So if you ever have any questions, any concerns, just want to say hi, please reach out. I'm happy to hear from you. And I thank you all for being a part of this and for all your support along the way.
All right. Thank you everyone for joining us this evening. We'll still be on here for just a couple more seconds. So if you want to still put those questions, if you have any in that question and answer box or the chat box, we will address those here in just a moment. But if you are new to TrueFunction and you'd like to work with us, or if you want us to help you with any questions regarding troubleshooting any of your current devices, feel free to scan that QR code on the left-hand side. That'll take you right to our new account form and allow you to create an account with us so we can assist you with any of your lab needs. On the right-hand side, that's going to be the QR code that'll take you to the education page on our website if you want to join us for next month. Next month, we're focusing a little bit on a different topic than we typically do. It is with Dr. Josia, focusing specifically on non-audigenic toothache, so specifically a clinical guide for dentists and kind of finding where the origin is from that pain. So that will be on Wednesday, July 30th. So if you, again, scan that QR code on the right-hand side, you can register and join us for next month. That's Wednesday, July 30th. We will be sending out a copy of this webinar. So look out, probably early next week, you'll be receiving that in your email. So keep an eye out for that. And like I promised, there is a promo code that we are running here through the end of July. So the end of June. So Frank, if you could go to the next slide for me. So if you would like to take advantage of the 20% off, that is, again, through the 30th, it's 20% off any milled True Herbs device. So if you'd like to try any of our True Herbs in that milled material, milled PMMA or milled acetal, most definitely take advantage of the 20% off. It's a great way to get started and kind of get trying the herbs if you've never tried it. Or if you're familiar with the herbs, get a little bit of discount for you. You'll just use that promo code Milled True Herbs on your RX or in the promo code section of DDX. So as long as you order before next, I think it's next Monday is the 30th, we would love to have you try out that Milled True Herbs. So it does look like we have a couple questions here, so we'll get to those. Dr. Arias is just saying thank you. And are you able to provide samples of the devices? If so, what's the cost? If you actually want to send me a message or a chat, we definitely have demo options and great starter kit options too. Where actually get demos and discounts on your first few cases with us. If you're new, I know you. It's anonymous in here, so I can't see if you are a current client or not. Doesn't matter though. You can still get a starter kit. It's a great way to, again, get those samples as well as a couple discounts on your first or next few cases. So if you either want to send me an email, Trisha, at TrueFunction, send me a chat with who you are. I'm happy to get that information over to you so that you can get some demos. I know that those are extremely valuable for your practice, so we definitely offer that as an option. All right, does anyone else have any questions? Okay, well, thank you everyone for joining us this evening. We're always so thankful to see you.
Thank you.
And have you spend your evening with us. We hope we'll see you in July, and we can't wait to have you on our next webinar. Actually, we do have another question here. If there's a problem with a case, has to be remade, is there a cost? So Dr. Snell, I can absolutely communicate with you on that. The great thing with TrueFunction is all of our devices are under warranty. So we have really great warranty policy you can actually find right on our website that talks about, how that falls and how to take advantage of a warranty. So we can definitely remake those devices for you, and we can always troubleshoot with you ahead of time too. So we'll reach out to you if, you have any questions, or if we have any questions at the beginning. So say where there's a device that we think your delivery is not going to be ideal, we'll always reach out to you ahead of time to help troubleshoot as quickly as possible ahead of time. But Dr. Snell, I know you have my information, and so you can find that on your resource page as well as on our website, or feel free to, we can talk in more detail. But absolutely, all TrueFunction devices are under warranty. All right. I guess all the questions were for me, not for you.
Wonderful, wonderful. Yes. Well, everyone, again, thank you for joining us. Yep, we'll see you next month. See you
All
next month.
right, everyone, have a wonderful evening. We'll see you on July 30th, and look forward to seeing you then. Have a great rest of your evening.
Thank you.